So good evening everyone. Today we are going to talk about nanostructured lipid-based carriers. What are the methods of preparations? What are the applications? And what is the importance of nanostructured lipid-based carrier compared to the other drug delivery systems? Let's see one by one the introductions, then the types of NLC, then what is the composition of nanostructured lipid-based carriers, methods of preparations, characterization methods, and marketed products. Okay, so nanostructured lipid carriers அப்படின்னு சொன்னோம்னா it containing the lipid nanoparticles. It is a second generation of lipid nanoparticles. The product from the blends of solid lipids and liquids lipids. The blend obtained are also solid at the room temperature and the body temperature. Okay, so the lipids should be solid with the body temperature as well as the room temperature. The solid lipids are mixed with the liquid lipids, preferably in the ratio of 70 to 30 percentage, the ratio of 99.9 percentage to 0.1 percentage. Okay, as a lipid matrix with a special nanostructure which improve the drug loading efficiency and firmly incorporate with the drug during the storage. Okay, so it is a benefit for the some other drug delivery system. So it can be administered with the various route of administration via oral route, ocular, topical, and intravenous route also. Okay, then even though they're having a lot of applications, it is have some limitations. The poor loading capacity and the drug expulsion after the polymeric transition during the storage. These are the drawback of these preparations. The relatively high water content of the dispersion is required, and the low capacity to load the water soluble drugs due to the partitioning effect during the production process. Okay, so how will overcome these limitations? Okay, let's see in the method of preparations and advantages. The advantage, it gives the better physical stability, the ease of preparations and scale up, increases the disposability in aqueous medium. So easily all the drugs are easily disposed in the aqueous medium. So it is improve the solubility. Okay, so high entrapment of lipophilic drugs. It's like lipid based drugs and hydrophilic drugs also. So control the particle size and advanced efficient carrier systems in the particular for substance, and increase the skin occlusions, and also provide the extended drug release. These are the advantage of nanostructured lipid carriers. Let's see, there are the two different types of NLC. First one is imperfect type NLC, like solid lipids or liquid lipids are blended together. The small amounts of liquid lipids and difference in the structure of lipids and special requirements in the crystallization process that leads to the highly disordered imperfect lipid matrix structure are formed. So it offering the space for the drug molecules and the cluster of the drugs. Okay, see the structure, see the figure, it shows the drugs, it will be incorporated in between the lipids based. Then let's see second type, that is a multiple nanostructured lipid carriers. It is a multiple oil, fat and water. The drug can be accommodated in the solid, but it is increased solubility in the oily parts of the lipid matrix. Okay, especially when you using that lipid based drugs, so the drugs are easily dissolved and disposed into the lipid matrix. So at high oil concentration, as a miscibility gap of two lipids occurs, so during the cooling phase, that's leading to the phase separations. That means the precipitation of tiny oil nano compartments are occur. Okay, then next one, it is amorphous type of NLC. The lipids are mixed in such a way that prevent them from the crystallizing. Okay, in the first method there will be produced a crystallizing problem. In the amorphous type the lipids are mixed in the way that prevents from the crystallization. So lipid matrix is a solid but in the amorphous state. For example, hydroxy octo sanyl hydroxystearate. Okay, see the the diagrams, it shows that the drug kit is incorporated in the amorphous type. Then it having that composition. There are the three different main components of nanostructured lipid carriers. First one is the lipids, water and emulsifier. Okay, these are the three main components. There are the several examples of solid lipids, liquid lipids, the hydrophilic emulsifier, lipophilic emulsifier and amphiphilic emulsifier. The emulsifier, it is one of the major components of the preparation of nanostructured lipid carriers. For example, solid lipids பார்த்தீங்கன்னா tristyrene, stearic acid and acetyl palmitate, cholesterol, glycerol, okay, then combitol, tribulite, ATO. Likewise, there are the several examples of solid lipids are present. Then liquid lipids, that medium chain triglycerides, paraffin oil, oleic acid and myglycol. Likewise, many more example of liquid lipids are also available, like capropyl 19. Then there are the several examples of emulsifier like pluronic F68. These are the hydrophilic emulsifier. Then twin 40, twin 80. Like we can use that polyvinyl alcohol. Okay, lyophilic emulsifier like myversol 18, span 20, span 80, span 40, span 60. Like amphiphilic emulsifier like gelisair 50/13, eclecithin, then soy lecithin, phosphatidylcholines. These are the example of the amphiphilic emulsifier. Okay, let's see the methods of preparations. The methods which we discussed for the nanostructured lipid based carriers, there are several methods are used. Homogenization technique, solvent evaporation technique, the micro emulsion technique, melting dispersion technique, double emulsion technique and spray drain technique. Let's see one by one. The homogenization technique in like a hard homogenization, cold homogenization technique. In this hard homogenization technique, the constant stirring with the high shear device, use of the piston gap homogenizer. After that, it is allowed to cool the room temperature. The cold homogenization, the drug is disposed in the lipid melt. Then the rapid refrigeration. The use of ice or the liquid nitrogen are used in these preparations to make a nanostructured lipid carriers. And then there are the several factors are involved in the technique like temperature and homogenization speed. Like the temperature, high temperature, low viscosity of the liquid lipids melt the lower particle size can be lead to the degradation of the drug and carrier. So that is another drawback. We could not keep the high temperature. Next பார்த்தீங்கன்னா homogenization speed, அதோட speed control பண்ணணும். High homogenization, high kinetic energy of the particles, the particle coalescence, the higher particle size. Then solvent evaporation technique, like the drugs along with the lipids incorporated with the water immiscible organic solvent, the emulsification formed with the HPH. Then we can use that micro fluidizer. The evaporation of the organic solvent are removed at the room temperature with the reduced pressure. In this method, the concentration of the lipid in the organic solvent dictates the particle size. Low lipid load, small particle size, the incorporation of the thermolable drugs. The disadvantage of these methods, the use of organic solvent may interact with the drug. It is cannot be completely removed from the drug. So limited solubility in the lipid in the organic solvent. Then microemulsion technique. So in this technique, the lipids are melted together along with the drug. The drug is incorporated with the molten lipid. The mixture is heated again, adding the melted lipid and continues with the stirring. The transparent and thermodynamically mixture is formed. Then melting dispersion technique. In this technique, the melting of the drug with the lipid in an organic phase, like oily phase, simultaneously heating of water at the same temperature. The addition of oil phase with a small amount of water with a continuous stirring at a high RPM speed with a few hours. Okay, then cooling down to the room temperature. So initially hit the temperature, then finally you bring the temperature to the cooling way. The melted drug to be incorporated with the lipids. Then double emulsion technique, the drug is dissolved in the aqueous phase, then emulsification is melted with the lipids with the form of primary emulsion. Then add the stabilizer, stabilized primary emulsion are formed. The disposition in the aqueous phase containing the hydrophilic emulsifier. These double emulsion is stirred and finally filtered. Then spray drying technique, the collateral dispersion of nanostructured lipid carrier is spray dried. It is cheaper than the lyophilization technique. Okay, so when compared to all other method, this is a easiest and cheaper method. It is also having some drawback. The particle aggregation due to the high temperature and shear forces are occur, and the partial melting of the particles. Only the particles are not completely melted with the lipids. Then there are the several characterization technique, like we need to find out the particle size, and we need to find out the zeta potential, the electron microscopy, and we need to find out the surface tension by Wilhelmy plate method. D is a differential scanning calorimetry by crystallinity. Then X-ray diffraction, whether it is formed amorphous or crystalline forms, that we can go for the X-ray diffraction method. Then NMR, the mobility of the materials in the inner core of the NLC, that we can determine by the NMR spectroscopy. Okay, the particle size that we can determine by the photon correlation spectroscopy. What is the shape and size of the particles? Okay, there are the several methods which we are compared with the nanostructured lipid based carrier based on the efficiency, based on the cost, based on the scalability. The nanostructured lipid based carriers and solid lipid nanoparticles, liposomes, and the lipid nanoparticles. And the nanostructured lipid carriers are high, improves the drug solubility and bioavailability, enables the drug targeted delivery. And cost wise, the moderate to high depends upon the formulation and production scale. Scalability pathina, high potential for industrial scale production with the microfluidizer. Okay, microfluidizing method. So compared to all other method, which it is a convenient method to manufacture the lipid based drugs along with the lipophilic drugs. There are the several applications. There are the several applications are involved in the nano lipid based carriers. They may be used for the topical administration, pulmonary drug delivery systems, oral, parenteral injection, and ocular. There are the several name of the drugs are available for the topical, like donipenzil, then ketoprofen, meloxicam, fluticasone. Okay, these are the drug are may be used for donidazepine, may be used for Alzheimer's disease, the ketoprofen for arthritis and skin inflammations. Let's see talk about the pulmonary drug delivery system, like Montelukast sodium. They may be used for prophylaxis treatment of chronic asthma. So that drug that to be made in the form of nanostructured lipid based carrier, it is available in the market. Okay, with a different brand name. Likewise, rapaglinide, simvastatin, apomorphine, and buprenorphine. These are the several drugs are available in the nanostructured lipid carrier for the oral administration. Likewise, we can go for the parenteral injection and ocular injection. They may be used for magniferin for cataract, then moxifloxacin for the treatment of endophthalmal limitus. Okay, okay, then flumiprufen, they may be used for anti-inflammatory drugs. Okay, so these are the main application of nanostructured lipid carriers. They may be used for the wide variety of drugs in the form of nanostructured lipid carriers. They may be administered for the different route of administration. So thank you very much for being patient. Thank you.